Welcome to Healthcare Reform Demystified. Today's episode, it's complicated. Administrative Simplification and the Affordable Care Act. There are some things in life that always seem to be more complicated than they really need to be. For example, tax forms, credit card statements, and any product bearing the words "some assembly required." Many people would add health care to that list. For every visit to the doctor, there may be new paperwork to fill out, questions to answer about your health status and insurance coverage, and a general sense that something might be missing. And if you need to see a specialist for something, getting them a copy of your medical records might prove more complicated than negotiating an international trade agreement. That's why the Affordable Care Act includes a somewhat innocuous-sounding provision called Administrative Simplification. While other parts of the law get more media attention, this provision has the potential to simplify most people's experience with the healthcare system. And over time, it could help keep a lid on costs to boot. For the sake of brevity, I won't get into the nuts and bolts of administrative simplification, but here's the short version. Among other things, this provision calls for implementation of a consistent, uniform system of standards for electronic medical records. The initial rules cover two types of healthcare transactions. The first is eligibility, determining whether a patient has coverage for a given service or procedure. The second is claim status, which is just that, determining the status of a healthcare claim, pending, allowed, settled, denied, after it's submitted to a health insurance company. Again, this sounds really simple and like something that wouldn't make much of a difference, but believe me, it isn't and it does, respectively. Here's how this should improve things for everyone. First of all, it decreases the amount of manual work that's required to record procedures and file claims. This alone will help eliminate errors and inconsistencies and reduce administrative costs. But wait, it gets better. In fact, I've come up with a list of the top 10 things to look forward to about administrative simplification. Drum roll, please. Number 10, faster claims processing. Number 9, fewer claim rejections and denials due to nonspecific diagnoses. Number 8, improved patient privacy and data security. Number 7, easier for physicians to share patient information. Number 6, more consistent and precise view of a patient's status. Number 5, more precise pricing structure. Number 4, helps support Medicare's initiatives to fight fraud and abuse. Number 3, improved disease management. Number 2, higher quality care for patients. And best of all, wait for it, fewer, simpler forms. All that from administrative simplification. Pretty impressive for two little words, huh? The administrative simplification provision is intended to reduce or eliminate needless complexity and redundancy in paper and electronic forms, make claims processing faster and more accurate, and reduce administrative costs throughout the healthcare system. And while it's going to take some time for all of these benefits to roll out, I think it's going to be worth the wait. Maybe I'll even have this thing figured out by then. You can find more answers to questions about the Affordable Care Act on the United for Reform website. And as always, contact your broker or a United Healthcare representative with any questions about your plan. What's an ectorp anyway? What do these pictures mean? And why are there no words?